A tragic story out of Nova Scotia where a woman died waiting for medical care at an emergency room. Gunter Holthoff of Tidnish said his wife Allison began feeling severe stomach pain on the morning of December 31st. They drove to the nearest emergency department in Amherst around 11 a.m. Holthoff said it was after 6 p.m. before they saw a doctor and Allison received any treatment.
And I told them, like, she's getting worse, like, she's in pain. And she said, oh yeah, we'll do what we can. It was all so much information, I don't even 100% know what I said or what she said, but something along the lines, like, I told her she was getting worse. I did, from there on, I did tell the triage nurse and the lady behind the desk, at least a couple times, that it was getting worse. She wasn't doing good. She was in pain, and there was not much of a response. We're doing what we can. We don't have any beds. She really didn't look good. Really didn't look good. I see my grandfather when I was little in a vacant coma, and honestly, he looked better at the time than she did now.
The CBC's Sarah Galashan is following the story. So, Sarah, what more do we know about the circumstances?
There's some heartbreaking detail coming from that press conference given by Gunter Holthoff, Andrew, about his wife Allison's condition the morning of December 31st. She had experienced stomach pain earlier in September, and since then there had been a certain amount of pain that she'd been dealing with. But December 31st, things were different. And so he says they got to the hospital in record time. You heard him say there was around 11 a.m. His account of this timeline, he says that he thinks that they were out of triage quite quickly by about 11:15 a.m. He talks about the kind of signals she was giving about the pain that she was in. He had to carry her into the Cumberland Regional Health Center. Then she was put in a wheelchair. And after triage at around 11:15, there they sat, he says, in the waiting room. She was most of the time slumped over in a wheelchair, at one point lying down on the floor in the fetal position to try and deal with the pain. And they were there throughout the day until around 3 p.m., he says, when they were finally moved into a room that he recalls had little to no medical equipment in it. And there they stayed in that room as she was an insignificant amount of pain. A doctor asking at one point whether or not she was had smoked marijuana, and she said that she had, or her husband spoke for her, saying that she had, that she used a vape pen at times, and the doctor suggesting that that can cause pain. At one point, she turned to her husband, Gunter, and said, "This is not from smoking marijuana." At one point, around 6 p.m. Or just before, she was screaming in pain, and that prompting a doctor to prescribe an IV for that pain. Things happening quickly after that, he says. About 6:30 p.m., she was moved into an x-ray room, and he recalls it was about 15 minutes after that he heard the call of code blue. He says that there were attempts she was resuscitated at 3 different occasions, but that she lost too much blood, and by 9 p.m., they had to have a tough conversation about the amount of blood that she had lost and her chances of surviving a surgery, and what the outcome actually would look like if she did even survive that surgery, of which there was little chance that she would. And Andrew, that's when he had to make the difficult call to let Allison go.
Is he getting any answers, and what are authorities saying?
Well, he is not. He says he's not getting answers from the autopsy, not a complete picture as to what exactly caused her death, and that's what he wants to know. In addition, whether or not delay in treatment or a misdiagnosis during triage may have contributed to this. The health authority not commenting due to privacy concerns. The Premier of Nova Scotia was asked to weigh in on this, and I want to play you his response.
Total sadness, I think, is what we all feel over that. So, we'll try to understand what happened there. There will be an investigation. There's a lot of questions, and I think we'll go through the investigation, try to understand, some of these questions, get some answers, and certainly have those discussions with the family would be my expectation, hope, yeah.
We also heard from the health minister, who is talking about the sort of added level of complication to what the staff at this Cumberland Regional Health Center are dealing with. Not only are they dealing with what we see across the country in terms of the short staffing and stressed out workers within hospitals, but there was a flood back in May of 2022, which caused them to have to relocate from the emergency room. And what we heard from Gunther's MLA is that those renovations to the emergency room were supposed to take 8 weeks, and there have been significant delays, and they're still not completed. So that's just an added layer, Andrew, to what is going on here.
All right, Sarah, thank you.
Yeah.